So April is Stress Awareness Month, and also on the app on Protrusive, we are focusing on mental health. And whilst I believe that, we always say, oh, I'm so busy, and I hear this all the time, and I say this all the time, but I always reflect on the following, that actually right now is probably the least busiest you'll ever be. But every time you think, oh my God, I'm so busy, I can never be busier than this. But you're kind of vulnerable to falling into this trap of saying this to yourself every year and feeling like, oh my God, I'm actually, busier now than I was last year. I've got more on my plate than ever before. So it's really important to break that vicious cycle. And a lot of the themes and things we're discussing on the podcast this month are of that topic. But this one is particularly specific to students because we've got Emma Hutchinson, our Protrusive student. And this time we just talked about managing stress as a student, how to prioritize your studies, how to figure out what your learning style is. We talked about imposter syndrome, the trials and tribulations of learning something that's so complex. Look, dentistry is not easy, it's complex, and it can get very overwhelming. So how do we manage those thoughts and emotions as a dental student? And I think actually, as all these episodes intend to be, I hope there's a lot in it for qualified dentists as well, who just want to get back to basics. And maybe you might be doing a master's or a diploma, and a lot of the themes that we cover will be relevant to you. As part of these episodes, one of the Protrusive Saga messaged me, and he bleeds blue. He's been a true Protrusive for some years now, and he reached out to me on our Instagram at Protrusive Dental, which by the way is managed. So if you want to get straight to me, you need to DM me on Protrusive Guidance. That is the best way to get through to me. Anyway, he messaged me on Insta. He said, Jazz, I listened to that adhesive episode, which was PS002. So we did an adhesive month. We focused on the basics, the student knowledge of adhesive dentistry. And he said he really enjoyed it. Even though he's a qualified dentist, he really enjoyed it. And it was really nice to have this moment where, how they say you should never really compare yourself to others. Like, on social media, comparing yourself to others, comparison is the thief of joy. The thing that we encourage is always looking back on yourself a few years ago. And what I always say is when you go on courses, that's a really great measure of how far you've come. Because at the beginning, when I used to go on courses, I was like a sponge. I was like, oh my God, I'm learning so much. It's really overwhelming. Now when I go on a course, it's little nuggets, little nuances, little tiny details, which still make it worth it. But you appreciate how far you have come. And so for him, the episode that we did on adhesive dentistry served as a reminder to him that, I knew this and I came a long way. But you also found it a nice revision, nice little summary. So if you haven't checked that one out already, do check it out. This one, like I said, is very much more mental health and stress. And I think it's absolutely essential that if you're a student, you share this one with your colleagues and the accompanying notes. So if you remember, Emma, our Protrusive student, is making her revision notes. And so the notes that she's sharing as part of this episode that we're releasing onto the Protrusive Guidance app, which by the way, if you're a student or anyone, all dentists can join. You just have to prove that you're a dentist or a student. And so if you're a dentist, at the time of applying, you will give your details and make sure that we can search you up and look you up on your regulator's website because we want to keep this a safe environment. But for students, you need to also email student@protrusive.co.uk that we can A, accept you, and B, invite you to the secret student area where you get a few more goodies. So the website for that is protrusive.app. The app is Protrusive Guidance. And in the Protrusive Scholarship section, we will put these notes. So this month's notes are alloys. Metals and alloys. I know it's boring. I know it's dental materials, but God, you need it for your exams and you need the knowledge. I think it's important to learn about dental materials. Anyway, I'll quit blabbing. Hope you connect with this one. Hope it makes a difference to you, your mental health, your stress levels. You learn about yourself. Learn about yourself as a learner, as a person, your emotions, all those kind of things. And I'll catch you in the outro. Emma, welcome back to our monthly student episode. I know last time we broke it up into two because it was so much goodness discussed there that it's probably easier to digest, broken into two. So if you guys haven't listened about the things that we check for in the real world when it comes to a routine examination, Emma's sort of questions and doubts in terms of how are we so fast and why is she so slow? Well, that's normal for a student to be super slow, and it will come with time, I promise. But today is something on the theme of this month, which is mental health. We're talking a lot about, for dentists, but I also want to talk about it when it comes to students. So if you don't know about Emma, please go back a few episodes. Emma is the chief Protrusive student, if you like. She is the gal who's going to basically inspire a generation of students who've been so great with her revision notes. So some of you have downloaded those already, which is great. So please keep posting and interacting in the community. But Emma, if this is the first episode that a student or a dentist has clicked onto, just briefly tell us about yourself and what we're covering today.
Yeah, so my name is Emma. I'm a third year dental student at Glasgow in Scotland. So we've been focusing the last few months on things that are maybe a wee bit more clinical, a lot more theory heavy. So this week we're going to, take a step back, make it a wee bit more lighthearted and just how to more look after yourself more than anything else. So a bit about mental health and just how to navigate dental school really, because it's a big, it's a huge part of your life, 5, 6 years for me actually because of COVID. But yeah, you've got to look after yourself during this time as well.
For a lot of people, dental student is like the first time, or dental school even is the first time they've been away from family. They might be living out. It's the whole social side of it, living arrangements and all that kind of stuff. So there's a lot to take in. And then, of course, dentistry being such a heavy degree. Like when I was living in first year with the two students who were doing English linguistics, someone who was doing landscape architecture, a lawyer student, and just all a mishmash of different subjects, right? I don't know if you experienced this as well. It came to a stage whereby they could go out most nights and we couldn't, right? Because we got patience, and you got to have that professionalism, right? And so the top tip I'll just give straight away is there's a phase of life that allows you to live in a certain way. And then if that phase of life finishes, you can't then relive. How's my friend's Nan used to say? This is advice from my friend's Nan. There's always a phase of life and you can't live that life again in the future. So I think there's probably a better Italian way of saying it. So what I mean to say is, if you don't enjoy yourself when you have the opportunity as a dental student, don't save it for fourth and fifth year. If you're going to go out, have fun in first year, enjoy yourself, get it out of your system, because when it comes to patients and stuff, you need to get on it basically. You can't be letting down professionalism. You can't be letting down your patients. You can't be smelling of alcohol, that kind of stuff. That stuff is way behind you, right? You got to really get it out of your system. And similarly, when you in your 40s and 50s, if you start hanging around with 19-year-olds clubbing, it's not going to happen basically, right? So there's a phase of life. You got to respect it, enjoy it, and then you move on to the next phase. So have you found that to be the case in terms of the difference between the dentistry students and other subjects?
Yeah, absolutely. I wasn't in halls in first year. I was just in a private accommodation with some friends from home. But I did have friends that were in halls. But we were the COVID year, we were the 2020 babies. But I would say, if you are one of those people, and not everyone is, that you want to go out and have fun and party and whatever else, get it out of your system in the first few years. In third year at the moment, it's okay because we only ever see patients in the afternoon. But at the same time, if I've got a patient the next day, I'm not I'm not staying out too late. Well, I'm 24
and
now.
as a student, but you're also revising the stuff like that you're going to have. Like when you're doing your first endo, you want to be like your checklist, watch the videos, watch the lectures before then. It's just the way it is when you're a student.
Yeah. So first and second year, you would find people out, dental students out quite often, the same as a lot of other students in different degrees. But when you definitely get more into your clinical years and things, stick to the Friday, Saturday type of deal. But, you'll survive.
That's true. But it is important, I think, to have that social outlet and to have this, part of uni experience, to go out. And I mean, some people are totally against it. I get it. That's fine. But it's important to have a social aspect. So do something, whatever you do, have a social element to it. I guess it's going to tie in nicely into what we're going to talk about. Have something outside of your studies that's going to keep you going. For me, it was the gym as a dental student. It was also video gaming. I played a lot of FIFA. It was my escape from dentistry, was playing FIFA actually. But you need to have something outside that. I was also working a part-time job. I was working in a bar called Jacosa in West Street in Sheffield. That was pretty cool, Saturday night. But, you've got to have something else going on as well. So do you have much, obviously you're a dental nurse, which is great. Obviously now you're with Protrusive, which is amazing. What else do you like to do outside of dental school?
So for me, I'm quite like you. I'm sort of in the gym quite a bit. But other than that, it took a few years to actually realise when you're seeing your friends, you don't need to be out at a club and drinking all the time. You can just go for a walk or go to the movies together. It doesn't need to be this whole party scene, because it does wear you down, all the rest of it. But no, honestly, just spending time with my family and friends, with my dog, going to the gym, it doesn't all need to be this whole club night scene, all the rest of it, which is fun at
Is it you that does powerlifting, Emma? You do powerlifting?
I used to do a bit of powerlifting, yeah. I don't so much anymore. I used to have like a coach and etc., etc. But now I just sort of, do my own thing in the gym and do things that I like doing. But yeah, there was a time where I was a little bit more competitive in it. But that was before uni anyway. But no, I just sort of do my own thing in the gym now. But I do enjoy it. I like lifting a weight above my head. So
good. And so for all students, wherever it might be, at some stage in final year, how I got rid of the stress was playing cricket, actually.
Yeah.
So we had a part of a cricket team local. So it's good to have some sort of outside dental school, but that stays with you throughout life. It's good to have something outside of dentistry. And I think I let myself down a few stages at dental school where it came to finals, right? Like the 4 to 5 run up to finals. I must have gone to the gym like twice in 5 months, which is very unlike me, right? And that's because I was so determined to give the academics everything.
Yeah.
And I go back, I look back, and it's easy for me to look back now and say I worked too hard, I shouldn't have done it. But what I really did is I let my health down. Right?
Yeah.
There's so many other benefits of exercise and stuff, and I really did not respect my body in that way. So if I could go back in time, I would have still continued my gym. I wouldn't have worked so tirelessly. I wouldn't have done all those all-nighters that I did do back then.
Yeah.
But it's easy to say now. When you're in the moment and you just want to, get through, you want to get a top mark and you want to work hard, then I get it. But if this does resonate with someone, that if you're really burning out, trying to work towards finals or something, that just remember that you're going to be okay. And it's okay to have a bit of time to look after yourself, is what I'd say.
Yeah, definitely. I've got a friend, Suzanne, who's a dentist now. She graduated in 2020, and I met her through nursing and whatnot. And, her biggest bit of advice to me when I went back to uni was, don't make yourself unwell with studying, because she said, like, she wouldn't go out. She felt so anxious that, like, she would struggle to, just feed herself and water herself and bathe herself. And it's just not worth it. Like, it's really just not worth it.
100%.
Yeah, it's
100%.
not. You need to look after yourself so that you can study in a way that's going to be efficient, really.
And this just reminds me of such an important fact, which maybe as a student you dissociate with, or you just don't realize, which is a bit like when you go for your first job or your fifth job, no one's going to care what percentage you pass with at final year, or how well you did. That's just like, you got a BDS? You're a dentist? Okay, cool. Tick. Now let me know about you. What motivates you? Are you friendly to my nurses? Are you a good communicator with patients? Are you enthusiastic about dentistry? These are the things that matter. Your emotional intelligence, how well you can identify lichen planus on a histopathological slide. Doesn't matter. It's important to pass the exam, and it's important to, in a way, as an academic, and we like to take pride in our academic stuff. But ultimately, that is not what's going to decide success in your career.
Absolutely. Like, you can get all the A's in the world and pass your exams, but dental exams are a weird one because you're never going to know everything. And sometimes it's just the nature of how the exams go. But, you're going to be a dentist, and then everything else comes after that. It's all about your personality and, how well you get on with people. And at an interview, that's what people want to see. They want to see what you're like as a person, because, you can do teeth. You've passed your exams, you are a dentist. At that point, it's what you're like as a person.
And with you being a dental nurse, having nursed so many dentists, you probably would have seen that actually some dentists, their margins, their crown part margins and cavity prep margins were better than some other dentists. You might have seen that. But ultimately, it's the one who just made the patient feel at ease, was a nice talker and calming to the patient and friendly, that they're the ones who seem to get better reviews or patients coming back. Have you made any such observations in terms of communication style?
Yeah, so the one thing that sticks out to me was I was working at a practice, and they were doing interviews for, we still call it VT in Scotland. Is it your foundation training?
For the international audience, let's say the first year out of dental school.
Yeah. So your first year out of dental school, we were doing interviews for that, and I was just on reception. And before that, this was during COVID, so it was all on Zoom. And the practice that I was working for, they wanted the nurses to sit in on the Zoom call because they wanted our opinions and things. And they knew that I was doing dentistry as well, so they kindly let me sit in and just see what it was all about. And there was this one guy called Chris who ended up getting shortlisted purely because, it's hard to tell on these things in Zoom interviews. There was maybe about 20 people there. It's hard to stick out, but he got shortlisted for an in-person interview because he just made a funny comment about, I think it's something stupid about the mug that the practice manager had or something like that. But just that one wee comment, people, myself and one of the other nurses were like, he seems funny. Like, let's get him in for an interview. And they did, and he ended up getting the job. But it's just wee things like that, that can go
the
far.
point of all this, guys, for those students listening, think, okay, where are we going with this, is I would love for all dental students to do right by their patients, do right for their family. Your family's rooting for you as well. You want to do a great job in your academics. Do it. Work hard, but not at the expense of your health, and realize that your academic success at dental school will not determine your success in your career. So it's important to have that. Have something outside of dentistry that you can do as well to keep your mind off things, to look after your mental health, and take things seriously, but seriously enough, not beyond that. right?
Yeah.
Going back to the beginning, there's always a time and place for the partying, and you really got to have that discipline to know
Yeah.
when it's okay to let your hair down and when really you need to show a bit of professionalism. So those are the main themes that we've covered so far. What other questions do you have in terms of the student life balance?
So I know you had mentioned about, your gym, that was sort of your outlet during your dental school years, but during your time at dental school, do you have any specific challenges or setbacks that you faced specifically that you could share, or things that you sort of didn't go well, but you turned it into a learning opportunity, I suppose, or common obstacles to be aware of?
Embarrassingly, I've already answered it. It's nothing, no embarrassing story here, but the whole thing I was going to say actually, and I remembered now, is with this one is just taking some parts so serious, taking it too seriously. So there was, thankfully, there was no major hiccups during dental school that I had in that regard. But, when I look back now, I worked really hard, and sometimes I just worked way too hard. And that's not what determined any success I've had. It's always been other factors. So just I think when I highlight that point again, I'm not going to make up a scenario where this happened and I learned something. It is just the truth that in the especially final year, man, I really wish I didn't work so hard. Now, conversely, the year before then, I went on my elective. Okay, it was a beautiful 6 weeks that we spent in total in Asia. So it was Thailand for a jolly, literally a couple of weeks because you had 6 weeks off. Let's go to Thailand for a couple of weeks, have a great time. 4 weeks in Vietnam, so 2 weeks with the charity, and 2 weeks let's explore Vietnam, right? So I made the most of it with my buddies Clifton and Dan. We had the best time ever. So it's identifying opportunities, right, and taking them where you can just be a student, right? Be human first, okay? And for those 6-8 weeks, we completely forgot about the academic side of it. So I'm glad I took those opportunities when they came. But when I went a bit serious, I went a bit too serious, and I didn't look after my health. And I wouldn't wish that upon any dental student, knowing what I know now.
Yeah, no, definitely. And I think just, I was on the verge of last year when I was studying for my second year exams, just sitting in the flat all the time, just study. And that's when I was speaking to my friend Suzanne, and she was like, go out for a walk, like go and see your friends, chat about something other than dentistry. Like you can't, at a certain point, you're not going to retain any more information, especially at 6 a.m. the day before your exam. You're not going to, if you've not remembered it by now, you're not going to, and that's totally fine. Just, recognize when it's getting a bit too far and you just need to, sit and have a cup of tea and watch a movie, or go and see your mum and dad for a few nights or something. Just take a pause and recognize that.
With that learning, the social side of learning, I think one thing that I was pretty good at doing is making little study groups. Shout out to Steph, Charlotte, Kelly, and John. We made a little study group, and we used to just, once a week, or sometimes when it got busy, 2-3 times a week, and meet up, and we just, okay, what did I learn today? What did I cover? What did you cover today? What's the main thing that you learned? And again, it just gets you out and about, and it makes learning social. And so I think it's really nice to learn for yourself because you have your own unique learning style, but see if a group learning can fit into the, optimizing what you retain and how you retain it. So group learning was a big part of my entire time at dental school. Every year I had a different group of friends that I would study with, or some that stayed consistent. And it's really nice to have that element. How you orchestrate it, how you guys run it, it's up to you, but it's nice to have that. And now extending that into the online world, there's a lot of online resources that we can use. And so if you're on the student scholarship program online, which is free for all dental students, hence why you listen to this and watching this, come on there and ask any questions you have, knowing that you've got other dental students around the world and dentists who are there to help you. And so if you're feeling like you're stuck and you need some help and guidance, remember that the social learning is so important that we have that available on Protrusive Guidance as well.
Yeah, 100%. Because sometimes, it's hard. I know I've said this before, it's hard to stick your hand up in a lecture and ask that stupid question, all the rest of it. But everyone on that platform, all there for the same reason, all dental students wanting to gain the same thing. So if anyone's got a question at all, just fire it in. Like there's not going to be a silly question, and there's bound to be someone else that's asking the same question. So no, if any questions, just fire away.
What I found useful during exam time, because ultimately the most stressful time is exam time, right? Is having past papers and that kind of stuff. Is that something that you guys have established at your uni?
No, so we don't have, there's things that people can share from other years, I suppose, and people obviously remember what the OSCE questions were last year, but no, we don't really have any sort of past papers or anything like that. Big no.
Well, I'm thinking of creating the whole section in the app basically where we can sort of pitch in with example questions and stuff. I think there's a lot we can do there. And OSCE is a great one, right? Like if every dentist on the platform came up with one unique OSCE scenario, then think about how much practice that you could do. And it's all about getting that practice in. So it's not about working hard, it's about working smart. Things that are actually going to count towards what's actually going to come up in the exam. So that's a really important thing to think about when you're stressing out and you're feeling that burnout kind of thing. Make sure you're taking your time for yourself, but when you are studying, you're focusing more on important, relevant things rather than opening up a textbook from a few years ago for something that's probably not going to make the mainstay of what you're going to be actually tested on.
Yeah, of course. And I think this, passing down of last year's OSCE questions, it's such a good way to study because, just looking through all your notes.
And speaking to people in the year above, obviously.
Yeah, of course. Like make friends in the year above. They'll have, countless amounts of advice to give you and, this sort of question came up in our exam and these are things that come up in every single exam. Speak to people and figure out what your university is likely going to ask you and that'll help
When
you
I was in third
tremendously.
year, Emma, I lived with two fifth years. I don't know if you know this, but in my finals, I was the first person in Sheffield history to get 100% in a finals exam.
Wow.
And I think it's because I had this like a sponge, like it was trickling down for them and I was there like absorbing it. I'm not saying like definitely do this and it might not be feasible for a lot of people, but just the way it worked out. So it's a great tip to mingle with the year above just to gain all that knowledge like a sponge and the mentorship and guidance and someone to say that, hey, you know what? I've been through this before. You'll be okay.
Yeah. And I think it's so important, networking dentistry, especially after you've qualified. But this was one of the things I wanted to ask you actually, Jazz. How crucial is networking as a student? Like, are there specific networking opportunities for students that you would recommend?
That's a really good question. Our first experience as dentistry, as a group of dental students, as friends, of networking in the real world, it is actually scary. Like when you go to a dental conference, like let's say the BDA conference in the UK or any conference, the students get a really good rate. Like they get a fantastic rate. So a lot of these places are free or like a really subsidized rate. So why not? Right? Because although a lot of it, you'll see all these products and services and you're like, whoa, what's going on? I feel like I'm in a different dimension here. It's so nice to have that exposure. It's so nice to go to these different lectures to see what dentists are learning, right? And to see that angle and get that exposure. So I think to make a really well-rounded student, to have an arm of networking is a really good thing. It's a nice thing because it just gives you something to aspire to. It helps you to identify role models and mentors. So I think networking is important. It's not like if you're really shy and you want to stick to what you do, fine, I get it. But I think you'll fly more if you have some networking opportunities available. Like if you're in a place where that exists, where conferences exist, or a local study club or something that you might have just searched online that meets up a group of dentists. If you go to a group of dentists and you're a dental student, you will get looked after really well, right? Because very few dental students actually turn up to these things. And so, you'll be like the baby and you'll get looked after. I used to get drinks bought for me and stuff. It was great.
Yeah, no, I think Glasgow do BDA every year, but it's usually only ever the later years that go, but it's definitely something that I'd want to do. Other than that, I can't think of any other opportunities.
So just a shout out to dental tubules in the UK. There's like a students week they have or like a day that they have, which is great. One day, hopefully, Emma, if all goes well and we get enough momentum, we can do something for protrusive students. Would be great, basically put a day on. But any opportunity you can identify to meet up with other dentists and other dental students like BDSA. Oh my God, my favorite part of dental school was BDSA. So those international students that we call the British Dental Student Association. So if you have a dental students association, so in the States, for example, if you have like a interstate sort of student gathering, they're so much fun. They're so good. And that was really the highlight. And, from your uni, Glasgow was well known for having always the best fancy dress. Like you guys would just absolutely kill it with a fancy dress.
We've got some good fancy dress, yeah.
What is up with that? But every year, like consistently, you guys, it's something like culturally just passed on, I think.
I don't know. I feel like every social that Glasgow has is some sort of fancy dress. I've got no normal clothes anymore. It's all fancy dress. But it's good fun. It's such good fun.
Absolutely. Now, I remember asking a question, and I was in final year of dentistry, because on this topic of networking and stuff, there was a conference whereby they had a composite hands-on workshop, and it was really cheap, or stroke it was kind of free or cheap basically. And I asked my tutors, hey, I know I'm only like fourth year, fifth year, but should I go to this? And he said, no, enjoy, go out, just enjoy being a student. You got all your career to worry about it, right? And when I look back, and I think that for me at the time, I think that was the wrong advice for me, because I was super keen, I was super enthusiastic, right? And the course was about posterior composite. It wasn't like full mouth rehab, it wasn't implants, it was bread and butter dentistry. And I think it was really wish I'd not listened to that tutor, and I wish I'd actually gone, because again, it would have been another networking opportunity, okay, and an opportunity to learn something different and see how things are applied in the real world. And so the point I'm trying to make is, although the courses aspect of it, yes, wait until you qualify, but if you do identify a cheap or a free course that gives you some exposure, that gets your leg in, that gets you to see the dentistry from a different perspective, then take that opportunity, especially if you really are generally enthusiastic and keen, and if you are listening and watching this, and you probably are, then take those opportunities when you can get them.
Yeah, absolutely. And I think a lot of times, maybe as a fourth year dental student, you would have felt so, I don't know, even self-conscious going in there. But if it means you get your foot in some sort of a door, or you make any sort of a friend or some sort of connection with someone, you learn anything, then why not? Why not just do it? As you said, it was free or it was really cheap. Like, why not just throw yourself in there?
And in that vein, when I was a first year dentist out of dental school, my principal said to me, Jazz, every year we go on this CPD. So CPD is the continued professional development. So the courses and the lectures you go on after you qualify, and you get like a certificate and stuff. And he said, look, we go every year, and it's tax deductible because it's educational. So he went skiing, and I said, yes, okay, let's go. Let's go skiing. And so I was the only like 1 year qualified dentist. Everyone was older than me, right? And it was just fantastic. Had such a lovely time, met some great people. And it showed me again that I saw all these principals, they own multiple practices, very successful, but they were there just letting their hair out, having a good time. We weren't talking about teeth the whole time. It showed me the human side of dentistry a bit more as well. But the crazy thing is, a few of the people that I was there drinking with, eating with, when I went to my interview for the next year, which is the DCT at the hospital stuff, the two interview panelists were on the ski trip with me. And I kind of walked in, I was like, wait, it's you two? And they kept it really professional. They didn't even look at me. They saw my name, they knew it was me, but they kept it very professional. And I was like, trying to smile at them, trying to get that connection going, but they weren't giving me any of it. But anyway, I passed with flying colours and I got the job I wanted, right? And so you never know. A bit of networking can get you in lucky positions sometimes.
Yeah, especially, even having a few conversations with those people, it's enough for them to remember that you're a normal person. And that's how obviously you're a good enough dentist that you got the job, but it's just something to be remembered by. All this networking, people will remember you. And sometimes that's enough just to tip you over the edge to get that job that you want, I suppose.
Yeah, I absolutely agree. I mean, I think the main lesson here is it's sometimes difficult because you might not get those opportunities, and don't feel hard or hard done by or sad that you're not getting these opportunities and everyone else seems to be going to all these exotic places, getting opportunities. Please don't feel bad. But if it's feasible for you and it works out, then don't shy away. Don't be shy about, I'm only a dental student, why should I go? I'm only 1 year qualified, why should I go? Be a yes person. Put yourself in an area of slight discomfort or other, and you will come out of it a better person and a more complete person, I think.
Yeah, and even for this job at Protrusive, it was my practice manager at the time sent me it, and I'd heard of Protrusive before, and he was like, definitely go for this. But I know that you were asking for maybe a third or a fourth year student. I was only a second year at the time. But I was like, you know what? I'll just go for it anyway, and I'll see what happens and put myself in that uncomfortable position and, a vulnerable position of rejection, I suppose. And here we are. So, yeah.
There we are. And I count my lucky stars because guys, Emma's been such a hard worker, and her notes are just brilliant. So that ties in nicely with your notes for this month are, I think, dental materials part 2, right?
Yeah, dental materials part 2. So we're going to be doing everyone's favourite topic again, dental materials, but we're going to be focusing more on metals and alloys this time. So yeah, quite a heavy one again, but very examinable and things that, you do need to know for your exams. So no, it should be a good one.
Amazing. Now, just as a final thing, is there anything else in your set of questions you had for me that you wanted to ask in terms of the burnout and the mental health perspective? Any guidance that you think would be useful for dental students as a final bit, or did we cover everything you wanted?
Final bit, I suppose. I know we spoke about this in the last one, but just would maybe want to reiterate it for this episode again was the whole imposter syndrome. And that's
Mm.
something I'm struggling with at the moment. I find that, I've seen all these amazing and brilliant dentists do all this fabulous work over the last 5, 6 years that I've been a nurse. And you guys all make it look so easy. And then I go in and I pick up my handpiece and I just feel like I can't do anything. But I know that you've said before that like it's just so normal and like it'll pass and you will able to, at the moment I need those 3 hours to do a checkup and x-rays and all the rest of it, but it'll get better and you'll get faster and you'll pick it up, but just try not to be so
You're
hard
at a
on
position
yourself.
now, Emma, where it just feels like everything is ridiculously long. I remember the first
Yeah.
root canals, like it's embarrassing to say the number of appointments. I remember the first time taking alginate, it must have taken 6 alginates. This poor
Yeah.
patient, right?
Yeah.
Right. And so this is totally normal for a dental student. You're doing absolutely fine. And just like all those dentists that you work with, they've all figured it out. You will 100% figure it out. Now, imposter syndrome never leaves you. Every time I think of doing something
Okay.
new, when I ramp up how much TMD I see, when I ramp up this, I always felt when I went to private practice, oh my goodness, it was sickening
Yeah.
to
Yeah.
the core. This imposter, I felt like I was not ready to be a private dentist. Like, who am I to be a private dentist? Surely
Mhm.
these dentists who've been qualified for 10 years, 15 years should be private dentists. Why am I being a private dentist kind of thing? So those thoughts will always haunt you, but it's
Yeah.
really important to give yourself the best shot and have a little bit of courage. Don't
Mhm.
be stupid. Don't be dangerous. And what I mean by that is it's always nice to just check with someone. So at the time when I was like getting imposter syndrome about going private, I messaged Drew Shah, who owns Dental Tubules. I said, Drew, do you think I'm ready for private? Like, here are the doubts I had. And Drew, being a good guy, but an honest guy, he said to me, look, Jazz, you've been to all these dental tubules things. You do so much extracurricular. I can tell that you love dentistry. Okay. And I feel as though you'll be able to look after your patients well. I think you'll be fine. And
Yeah.
just to have someone to just comfort you through that and to guide you through that is really good. And so have a circle of people that you can ask
Mhm.
some questions, have a mentor or something, which is a whole topic in itself, but something that can come with time. And so imposter syndrome, the antidote to that is having faith in yourself.
Mhm.
Not blind faith, like, actually assess that, okay, am I actually ready for this? Okay. You want to be always at the edge of your comfort zone. Okay.
Yeah.
Right. And maybe just beyond it, but not so far along that you're dangerous or reckless. Right. So
Yeah.
sometimes it's about having self-awareness. Right.
Mhm.
And sometimes just handing it to yourself that, you know what, I do know something and I can do this and I've done it before and I'm going to do my best to prove myself in a safe way.
Yeah, I like what you said there about you want to always be on the edge of your comfort zone. That's good, and getting comfortable with feeling uncomfortable, I suppose, is
Mhm.
a way to put it.
Yes, but
Hmm.
you don't want to be like constantly, like, imagine the flight and fight response if you're constantly feeling
Yeah,
that way, right? It's not good.
yeah.
You still want to stay in your comfort zone. Comfort zones are
Hmm.
good. If I was to give like in a year, if 80%, 85% of procedures I do are like, this is like a home run for me. I do this day in, day out. This is bread and butter. Fine. But I want maybe 10% of it to be at the very edge of my comfort zone, like,
Yeah.
really tricky cases that I've been on lots of courses to develop and is really pushing me. And then 5% be just beyond my comfort zone. But for
Hmm.
that case, I would have had mentors look at my photos and talk me through it, give me the pep talk, been on a recent course for it. So it's a new skill that I'm adding. And I think with
Hmm.
that framework, 85, 10, and 5, this is something I just completely made up, but like kind of like if I was to reflect all the kind of stuff I do. But that's a good way to think that, okay, it's okay to be in a comfort zone. You kind of need,
Hmm.
you can't be constantly in your zone of discomfort, if you like, but it's important to experience it, embrace it, and
Hmm.
push through it, because that's where the growth happens.
Yeah, embrace it for sure. Just what you're feeling is totally normal. And everyone's felt like that, and it's all happening, but you'll get through it, and it'll
There
all
will
be
be
fine.
dark times, Emma, in
Yeah.
your student career, like, the 5, 6 years. There'll be dark times. It could
Hmm.
be something to do with relationships. It could be something completely non-dental, right? It could be something to do with family or whatever, right? But it's important to have someone to talk to. And there's loads of great student support networks out there with unis and stuff. Utilize
Hmm.
them and make
Yeah.
sure you're always looking after your mental health. And listen, Uncle Jazz is always here for you. So on the app, make sure you comment, even if it's like anonymously or whatever. We're here to help as a community. We got your back. Emma, thanks again for another great episode. It was
Thank you so
nice
much.
to spar and discuss about these kind of topics. All right, so next next month is orthodontics. Okay, have you had any orthodontic clinics yet?
Yeah, so we're just being chucked into orthodontics at the moment. So already making those notes and taking mental notes of everything that
Yeah,
I
make
think
a
are going
nice
to be
intro
helpful.
to orthodontics for dental students.
Yeah.
That's the kind of angle to go by. Orthodontics for me at dental school, like we'd show up in the clinic and it was nothing like restorative. It was restorative. I had no clue what was going on, but that was a whole new level in orthodontics. It was like, what is going on, right? So I'm actually excited to discuss that. So the month is called May the Force Be With You.
Perfect. Thank you so much.
Amazing. Thank you so much. Well, there we have it, guys. That wraps up this month's Protrusive Students episode. Join us again next time for more goodness from our Protrusive student, Emma, who's doing a fantastic job, isn't she? Please do reach out to us on Protrusive Guidance. Please DM Emma and tell her what wonderful job she's doing. And make sure you DM me and say hello as well. Thank you so much for listening all the way to the end. I'll catch you same time, same place next week. Bye for now.